My name is Sarah Collins-Stockton, and I will be analyzing, diagnosing, and proposing treatment for John Nash, the main character in A Beautiful Mind. John Nash was a real person. He was a mathematician, and the story in the movie takes place from about 1948 to 1995. The main focus, though, was the 1950s Cold War era. The diagnosis for this character is schizophrenia. The word schizophrenia means splitting of the brain and is characterized by alterations in thoughts and perceptions, as well as a disconnection or misinterpretation of reality. This is commonly shown by the patient having hallucinations and delusions. With regards to the movie, culture did play a key role in Nash's bigger delusions. He believed he was working against Soviet threats. This is heavily correlated with the fact that the year was 1954, the Cold War was happening, and fear of communism had taken over the entire country. These delusions were brought to the attention of a psychiatrist who diagnosed John correctly, and schizophrenia itself, as a whole disorder, is diagnosed across all cultures because anyone who has it often lacks the ability to hide it due to the fact that they believe that everything that they're seeing and experiencing is reality. Because of this, the symptoms can often go unrecognized by the patient, but the symptoms do call the attention to everyone around the patient. Though our society is improving in social awareness of mental disorders, schizophrenia is still heavily feared. There is a stigma that people who have the disorder are dangerous and unstable even when they're receiving treatment. So, John showed many symptoms of schizophrenia. The two most prominent symptoms were delusions and hallucinations. A delusion is a belief that is maintained despite being contradicted by reality and rational argument. A hallucination is an experience involving the perception, and in this case presence, of something that is not there. In the movie, John had the delusion that he worked for the U.S. government and decoding Soviet threats put in the media concerning a bomb. He put several letters related to this delusion in the mailbox of an abandoned home, thinking that the government was collecting them. John also had three main hallucinations: his college roommate, Charles Herman, Charles's niece, Marcy, and the boss of his apparent secret project, William Parcher. Though John showed all of the positive symptoms before treatment, he did not show many of the negative symptoms, and the negative symptoms that he did have were less occurring and less severe than the positive. For example, he never showed slowed speech or monotonous tones before treatment, though when he was treated, there was a lack of emotion in his demeanor. So, due to the times, John was diagnosed correctly in the film, but treatment was limited. Because of this, he was put on a conventional antipsychotic and was administered insulin shock therapy 5 times a week for 10 weeks. Because of the times, there was no access to newer medications that targeted schizophrenia-specific symptoms. Insulin shock therapy was questionably unethical here and would not be administered to John today. My proposed treatment plan is to put the patient on 5 milligrams of Zyprexa, an atypical antipsychotic commonly used today to treat symptoms related to hallucinations in schizophrenic patients. On top of this, I would suggest seeing a psychologist twice a month. It can be argued that the low dosage of my treatment of Zyprexa, of what I would like to treat the patient with, is unethical, but he did have a heavy unwillingness to any treatment at all because he was afraid to be overtreated and sedated. So I would start at 5 milligrams personally and then maybe work up if he finds that it's not helping him. So for the most part, A Beautiful Mind did a good job at portraying the symptoms and life-changing tolls that come with schizophrenia. John portrayed all of the positive symptoms such as delusions, hallucinations, paranoia, and had continuing disturbances for at least 6 months before he was diagnosed. It is even portrayed how being diagnosed with schizophrenia can cause issues between you and the closest person to you. For example, John and his wife had issues when he was first diagnosed. The film is pretty accurate, although, along with other disorders portrayed in films, Hollywood tends to focus on the extremes of a disorder, which can lead to biases and people being scared of it instead of trying to understand it.